My name is Josh Charles, and this is the beginning of my report. For this presentation, I chose Staphylococcus aureus, which is a medically significant bacterium. It is a gram-positive coccus, which means it is round and stains purple on a gram stain. It usually grows in clusters, kind of like tiny bacterial grapes, except these grapes can give you an infection, so maybe do not put them on the charcuterie board. Staphylococcus aureus is important because it can live normally on people, especially on the skin and inside the nose. A person can carry it and not feel sick at all. This is called colonization. So basically, it can be living on your body rent-free, minding its business until it decides to become a problem. The issue starts when it gets into places it's not supposed to, like cuts, wounds, IV sites, surgery sites, or weakened skin. That is when it can become pathogenic and can cause infection. In hospitals, it can be more dangerous because patients may have open wounds, catheters, surgery sites, or weaker immune systems, just be compromised in general. One toxin connected with Staphylococcus aureus in the lecture notes is leukocidin. Leukocidin is a membrane-damaging toxin, also called a cytotoxin. It can insert into cell membranes and form pores, which can damage or kill host cells. Basically, it punches holes in the cells like it has zero respect for personal space. The lecture slides connects Staphylococcus aureus with wound and other infections, and leukocidin is associated with the buildup of pus. That makes sense because pus forms when white blood cells, the tissue, and bacteria collect at the infection site. So when you see pus, that is basically your immune system bacteria having a disgusting group project. Some major virulence factors in Staphylococcus aureus include toxins, enzymes, adhesion factors, and immune invasion, and biofilm formation. Adhesion factors help the bacteria stick to tissues or medical devices. Biofilm helps protect the bacteria from the immune system and antibiotics. It is like the bacteria builds a little fortress and says, "Good luck getting me out." Staphylococcus aureus is associated with many diseases. The most common are skin and soft tissue infections, such as boils, abscesses, cellulitis, and wound infections. Sometimes this can include redness, swelling, warmth, pain, pus, drainage, and sometimes fever. Basically, if your skin looks angry, swollen, and dramatic, Staph could be one of the causes. Staph. MRSA stands for methicillin-resistant Staphylococcus aureus. It can cause similar infections, but it is harder to treat because it's resistant to some antibiotics. Regular staph is already annoying, but MRSA or MRSA is like staph that went to the gym, got a villain origin story, and decided antibiotics were optional. Staphylococcus aureus can also cause more serious disease if it spreads deeper into the body. Things like pneumonia, bloodstream infections, sepsis, bone infections, endocarditis, and infections involving medical devices. It can also cause toxin-mediated illnesses like food poisoning, toxic shock syndrome, and scalded skin syndrome, depending on which toxins are produced. Treatment depends on the type and severity of the infection. Minor skin infections may need drainage and sometimes antibiotics. More serious infections may need stronger antibiotics, lab testing, and sometimes hospitalization. If the infection is caused by MRSA, doctors avoid antibiotics that will not work and choose treatment based on susceptibility testing. That means they test which antibiotics actually kill the bacteria instead of just guessing and hoping for the best. There's currently no widely available working vaccine for Staphylococcus aureus, so prevention is important. Good hand washing and keeping wounds clean and covered and proper infection control in hospitals can help reduce the spread. Overall, Staphylococcus matters because it can be normal flora on the skin or in the nose, but it becomes dangerous when it enters wounds and the bloodstream, lungs, or medical devices. Its toxins, biofilm formation, immune invasion, and antibiotic resistance make it a major medical pathogen. So basically, Staphylococcus aureus is like that person who seems harmless until they get into the wrong place and suddenly causes a whole situation. For my information, I use my lecture notes from slides 26 through 29. I also use the CDC pages on Staphylococcus aureus and MRSA, a StatPearls article from the National Library of Medicine, and peer-reviewed articles by Chung, Bay, and Otto, and Oliveira, Borges, and Simoes. The full references are listed in my separate PDF. Thank you.